Hi, good morning, Rachel. My name is Edward Rockwood. I'm your invigilator for the OET speaking session on the 8th of July 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Rachel Morgan.
And what is your candidate number, please?
My candidate number is 252811507.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are some things you think are challenging about nursing?
I can only imagine some of the challenging things nurses face. One thing I think may be most challenging is handling situations when patients do not want to pursue life-saving efforts, but their families disagree. I also feel, if we are not careful to learn about and practice cultural competence, significant challenges could arise due to the cultural diversity within healthcare facilities and among patient populations.
What are some negative effects experienced by nurses?
Some negative effects of long work hours are fatigue, stress, or anxiety. I think that's true of any job or situation that requires a lot of time and effort. I try to combat the negative effects of stress, both personally and professionally, by practicing self-care and relaxation techniques. I also try to spend time with friends and loved ones outside work, so I can have a healthy work-life balance.
What is the longest amount of time you worked at one job?
Most of my work experience until now has been after my BSc graduation. I have worked on 3 hospitals and severed almost 6 years in total. Current employment is the longest duration so far, 2.5 years.
Have you worked in a supervisory role in any previous job?
I've never worked in a manager or lead supervisor position. I have worked as a team leader in a few NGO, although I didn't have the authority to hire or fire employees or handle disciplinary issues. I helped with schedules and daily assignments.
In your opinion, how important is open communication between team members?
I believe open communication is crucial for team members, no matter what profession one chooses. As a nursing student and future nurse, I understand how I communicate with peers and patients could significantly impact how our team functions and how well patients respond to our care.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Rachel Morgan. I am one of the registered nurses working in this community health center. How may I help you today?
Good morning, nurse. I am here to get support, as I deeply wish to quit smoking.
Good to hear. Definitely, I can help you in ceasing your smoking habit. Before moving on further, may I know your name and age for the record, please?
Yes, my name is Edward Rockwood. And I am 40 years old.
Thank you, Edward, for your information. Now, shall I ask you a few questions to have a better understanding of your situation?
Sure, you may please proceed.
May I know in detail about your smoking habit?
Well, nurse, I usually smoke around 20 cigarettes per day for 25 years.
Okay, Edward, what cigarettes are you using?
I smoke by rolling my own cigarettes. Mostly, I smoke every evening, and only a few during the day.
All right, may I know the reason why you have decided to quit smoking?
Why not? I had my 40th birthday yesterday. Moreover, I recently became a parent. That is the main reason why I decided to quit smoking. It is for my family as well as for my health.
You made a very good decision. I am very happy to help you. First of all, I suggest you engage in some other activities whenever you feel the urge to smoke. You can involve yourself in some pleasant activities such as calling a friend, watching movies, enjoying some delicious meals, etc.
Actually, nurse, I have tried all these things that you have suggested. Interestingly, it often acts as a trigger for smoking. See, nurse, I have already tried to stop smoking and returned back to my smoking habit. Could you please put forward some other methods of smoking cessation for me?
I realize your situation. Surely, I can provide you with some other techniques, which might be quite helpful.
That sounds good.
Yes. The first thing, which I suggest is a Compix tablet, which is available in pharmacies. It could help you to reduce the craving and block the rewarding effect of cigarettes. How does that sound?
It seems to be effective.
Great. The next one I can advise you is to use electronic cigarettes, which could satisfy your craving for cigarettes without a damaging effect, especially avoiding nicotine.
That is also a good idea. Now, what should I do first?
Your question is thoughtful. I appreciate your enthusiasm. The next step is to build a plan. Don't worry, we will build a plan together.
A plan? Can you please explain it?
Yes, of course. The initial step in our plan is to identify the triggers for smoking and try to avoid it to the best.
Okay, I will.
The next and most important thing that you should keep in mind is that there are many rewards and benefits that you can earn by stopping smoking.
Rewards? What does it mean? Can you please explain?
Yes, definitely, it is my pleasure. By quitting smoking, you can save money. Moreover, you will smell nicer. In addition, it will avoid the risks of health problems, and also, it is very much better for your baby.
Yes, you are right.
Great. Now, we will fix a date to give up smoking completely, and I can prescribe the Compix tablets for you. At the same time, if you wish, then you can buy an electronic cigarette before the date we decide to quit smoking.
Okay, nurse, I will definitely attempt all your suggestions and see how helpful they are for me. I kindly request you arrange a weekly appointment for me until I stop smoking.
I acknowledge your concerns. It shows your desire to quit smoking habit. Definitely, Edward, I can schedule an appointment once every week for you to check on your progress and to make necessary management. Are you happy with that?
Yes, nurse, thank you for your non-judgmental approach.
It is my pleasure. Thank you for accepting my suggestion. I wish you all the best to cease your smoking habit.
Thank you, nurse. That's the end of the OET speaking roleplay. All the very best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.